often in patients who have suffered long-term concussions, serial concussions, will have normal-looking brains on autopsy. But it's really the microscopic analysis of the brain, of portions of the brain, that could reveal the effects of multiple concussions over time. It's not certain as to whether some patients are more apt to get these findings, such as an abnormal accumulation of protein in certain parts of the brain that can indicate that they are suffering from the effects of multiple concussions. What concussion really is an alteration of someone's consciousness. At any point, you don't necessarily have to pass out to have a concussion, but you can have see stars or feel a little dizzy after an impact either directly to the head or close to the head. And when we get imaging on many patients who have suffered concussions, they're often quite normal. When a person comes in with a head injury, there are several types of imaging studies that we can get. The most common immediate type is a CAT scan, which can show blood in the very early stages, and that shows up as white on a CAT scan. And we're able to easily tell if there's any damage to the brain based upon the initial injury. Later on, perhaps, if a person is having persistent symptoms or there are other reasons, we can get an MRI, which is a more detailed picture of the brain itself, but sometimes does not enable us to see blood in the early stages. That's why the CAT scan is really the first line of imaging for head injury.